I'm Garrett. This is my skull trigger assignment. First I'm going to go get the patient, introduce myself, and get started. First I'm going to be doing my sinus series. So that's what this is. Sabina, come on in. Hi Sabina.
Hello.
What's your last name?
Brooks.
Okay, and what's your date of birth?
September 20th, 1991.
And doctor that ordered this for you?
Dr. Boone.
Alright. Any chance of pregnancy?
Nope.
Okay, and then have you come on up here. So the first one I'm going to be doing is a PA axial Caldwell. Caldwell method is to look at the frontal sinus and also the anterior of the ethmoid sinus. So I'm going to have her come on up to the table bucky. I have an 8x10 size cassette in the wall, in the wall bucky, not the table. So for this one, we want to have the OML at a 15-degree angle to the IR. Sometimes we can have the wall bucky tilted up this way, but we're not going to do that this time. Instead, we're just going to have a sponge in between the forehead and the bucky so that it makes the OML 15 degrees from perpendicular. So we get her up here. We have the central ray coming in and exiting at the nasion. And that's about it. Our technique is going to be anywhere from 70 to 75 kVp, 10 to 12 mass. You can also sometimes use a cone, which makes better contrast for this image. And back up here.
Patience.
So I'm going to have my marker left side marked, and I'm also going to have her shielded around the waist region to cover her ovaries, and also upper butt to cover her breasts. And that's it. Okay, so the next image I'm going to do is the Waters method, also known as the parietal acanthial. This one demonstrates the maxillary sinuses. So what I have is the patient set up, face touching the bucky, 8x10 cassette in the wall bucky. For this one, the OML is going to be at a 37-degree angle with the IR. So to do this, we have the patient's chin and nose touching the board, creating that 37-degree angle. The CR is going to come in and enter the back of the skull and exiting the acanthion this time, which is just below the nose. The technique for this is anywhere from 70 to 75 kVp and like 15 to 20 mass. And this one, like I said, demonstrates the maxillary sinuses. So another method that we can do to look at both the maxillary and sphenoidal sinuses, that's just the open mouth waters. And this one, it would just involve the patient opening the mouth and touching the board like that. I have her shielded, everything from the neck down. And I have my left marker on the board, just to the left of the skull. And that's it. The next image I'm going to do is the lateral projection, to look at all four sinuses, the ethmoid, sphenoidal, maxillary, and frontal. So I have the patient positioned almost in an oblique position, but I just do that just so her face can be completely lateral on the bucky. I have an 8x10 film in the wall bucky. For this one, the central ray is going to enter just about half an inch to an inch behind the outer canthus, just behind the orbit region. For this one, the interpupillary line is perpendicular to the IR. The IOML is horizontal, and technique for this is 70 kVp at about 8 mass. Have the patient shielded, left side against the board, so I'm going to use my left marker to mark it, and that's it. So the last projection I'm going to do for this sinus series is the SMV. This involves the patient seated with the head tilted back. For this one, she's going to be tilting her head back and touching the wall bucky. I have an 8x10 cassette in the wall bucky. For this one, the IOML is going to be parallel to the wall bucky. So it's right below the orbit to the EAM. It's going to be parallel to the wall bucky. That's how we line up. For the CR is going to be perpendicular to the IOML in the wall bucky, and it's going to be just 3/4 of an inch anterior to the anterior to the EAM. So the EAM here, we're going to be 3/4 of an inch just above here. For this one, 75 kVp at about 8 mass is probably fine. And what else? The central ray is also going to be perpendicular to the solid tersica. and that's it. Okay, now we're going to do our mandible series now that our sinus is done. The first one's the PA mandible. This involves the patient facing the bucky, 8x10 cassette in the bucky. This time we have the forehead and the nose touching the bucky to make the OML perpendicular. The central ray is going perpendicular and exiting through the acanthion. I have her shielded. I'll use my left marker. Mark the left side. This is going to show the body and the rami of the mandible. Okay, is that one? X-ray. Then it comes down like this. We angle the tube up at 25 degrees cephalad. Right, 25?
Mm-hmm.
Okay, 8x10 in the bucky. OML is going to be perpendicular. You can just leave her how she was for the last one.
Thanks for the toy, bro.
Alright, I have her shielded, marker, same size cassette. Basically very similar. Just going to show the body and the rami, the mandible. Shoot that one. Okay, stop real quick. Okay, so this next one's the axiolateral projection. It's again 25 degrees cephalad. She is now like in the RAO facing to the right so that her interpupillary line is perpendicular. What? She is shielded. My marker actually, I'm going to switch to the right marker because her right side's against the board now. So over here. And it's 25 degrees up and into the area of interest. Again, this is going to show the ramus in the body. So I'll shoot that one. Make sure. Okay, then the last one is the SMV. She's going to flip around and put her back on the board. Again, 8x10 in the bucky. She's going to lean back and put the back of her head on the board. This time making it so the CR is perpendicular to the IOML. And the IOML is going to be parallel to the bucky. Let's see. I have her shielded. The marker is now going to be on this side, the right marker over here. This one's going to show the coronoid and the condyloid processes of the mandible. And that's it. X-ray. Talk about my techniques of the
Yeah. Need it done.
What? Okay, now we're going to go over the evaluation criteria for our sinus images to make sure that our images were acceptable. The first image we're looking at right here is an example of the PA paranasal, the PA Caldwell projection. For this one, we want to make sure the petrous ridges are demonstrated in the lower third of the orbits right there. The frontal sinuses should be situated above the frontal nasal sutures, and also the anterior ethmoid sinuses are demonstrated immediately lateral to the nasal bones and directly below the frontal sinuses. And on top of all this, we want to just be sure that there's no rotation evident. Okay, our second image we did was this one. It was the parieto-canthal Waters method. For this one, we just want to make sure that the petrous ridges are again immediately, or this time below the maxillary sinuses, indicating proper extension. And no rotation is evidenced by equal distance from the lateral border of the skull on each side, as we can see that right here. Okay, next image is the lateral sinus. For this one, we just need to make sure that all the sinuses are visualized: the frontal, the ethmoidal, maxillary, and sphenoidal sinuses. No rotation should be evidenced as shown by superimposition of the mandibular rami, and the orbital roofs in the sella turcica is seen without rotation. The last one of our sinus series is the SMV. For this one, we want to make sure that the mandibular symphysis is superimposed, right here, superimposed on the anterior frontal bone, indicating adequate extension of the tube angle. Make sure there's no rotation again. We can make sure of this by noticing the symmetrical petrous ridges. And yeah, those that's the evaluation criteria for our sinuses. Okay, now we're going to go over the evaluation criteria for our mandible series. As you can see, we got a nice image here that's labeled. The condyle up at the top, coronoid process, ramus, body, and symphysis. So we should see all that in this first image, which our first image was the PA projection. Evaluation criteria, the entire mandible should be included. Nice that we got all of it labeled right there. We can see it is all included. No rotation is evidenced by symmetrical visualization of the rami. Real simple one right here. The next one we have is the axial mandible. This one we'll zoom in on a little bit. The condyloid process in mandibular rami should be demonstrated without rotation as evidenced by the symmetrical views of the rami. Yet again, so that's what this one looks like. Right here we have the axiolateral mandible. Again, we have nice image right here that's labeled, so we should see the entire mandible in this image. So the area of interest should be well demonstrated, whether it be the rami, the body, the symphysis. No superimposition of the opposite side of the mandible. So that is it for the evaluation of our mandible series.